Welcome to Democratic Television, a program of the Santa Clara County Democratic Party that brings insights, perspectives, and attitudes of our always thoughtful Democratic guests. Today our guest is Bob Applebaum, a longtime Democratic activist and a great guy, and frankly, Bob, a neighbor of mine. So welcome to Democratic Television.
Well, it's an honor to be here with you, Steve, and I'm glad that you invited me tonight, and I hope this all goes well.
I hope it goes well too, because the topic that we're going to get to after we talk about another important topic is health care,
Right.
and it couldn't be more timely.
Absolutely.
But we're going to talk about you first.
Okay.
Okay, so where are you from? Where'd you grow up? What were some of your interesting hobbies?
Well, I grew up in Brooklyn. I'm only out here 11 years,
Oh,
and spent the summers in the Catskill Mountains.
oh,
My dad was in the ILGWU for 45 years. He worked in the sweatshops. He was a tailor on samples, on very fine quality stuff. But because of that, he felt it was important for the family to get off the hot city streets for the summer. So we'd go to what's called a kachalain, where you do your own cooking. You're renting a room and part of a kitchen, and we'd spend the whole summer up there, from the last day of school till Labor Day, and that was a very good time. So when I started thinking about retirement, well, for 15 years before, I told people that I was going to be moving out to the Bay Area, even though it was almost law in New York that you're supposed to retire to Florida. I couldn't take the summers in New York. I don't know what I would be doing in Florida. So we decided to move out here, and we had a couple of our kids here. We had our youngest was at Stanford. He met his wife there.
oh.
And our didn't know if they would stay or not, but my middle son was a double EE major at MIT, and I knew that that was a no-brainer. He'd be here at least anyway. So we now have 6 grandkids. We have 3 sons, 5 grandsons, and a granddaughter. Three of the grandchildren are here, 2 in Maryland, 1 in Vermont, all blue states, and so things are going pretty well.
So, but I'm interested in your father growing up in the garment industry, and as you say, a sweatshop. Did he work all day and into the night?
Yes, his
make a living for the family?
He worked all day, and I mean, he never made a lot of money. I used to do his taxes when I was a teenager. It was never much over $8,000 a year at that point, and he retired with a $125 a month pension after 45 years. So that wasn't very much, but we managed. We never felt that we were poor. We had a roof over our heads. We had food, family. So it was okay.
How did that help you in terms of figuring out what do you want to do for the rest of your life besides?
Well, there were other things, that I never felt like I fit in. I kind of withdrew a little bit. I always felt a little different. We were in the mountains. My mother had some paranoia. And I would go off and explore nature by myself through the woods. And one day they were digging a new cesspool. They had the equipment there, and I was gone for about an hour and a half. When I come back, my mother was there crying over it. I mean, if I wasn't there, the only logical explanation she could have is I must be in there. I learned to pretty much make my own judgments about things, so it's like a Peter Pan complex, or the Emperor's New Clothes. The innocence of youth that carries on. I never developed the follow everybody else. I always had to figure things out pretty much for myself.
Kind of your own path.
Yeah. So it's not paranoia. It's just being prepared. Learning enough about all. Making up your own mind of something that's logical. It works.
Now, I have known you for a number of years as a Democratic activist. You're very committed to the values of the Democratic Party and want to carry out the platform. Obviously, one specialty of yours is health care.
Yes.
Where did you get that feel for, not health care necessarily, but the values of the party? Was that something that you talked about at the dinner table?
Yeah, well, again, this is something that I felt was very important to me, and I don't like things being done in society that are detrimental or wasteful. I'm socially very progressive, fiscally conservative. I want to make sure that things are sustainable and you can pay for them. But as far as healthcare, though, I was payroll and benefits manager at the American Museum of Natural History for 27 years. And I they had a variety of health programs that were negotiated between the unions and the city of New York, and even though we were not a city agency, we were allowed to use them. They weren't quite good enough. This was an academic community, and it wasn't complete. So I established a very comprehensive major medical plan and dental, and I got so annoyed with the insurance companies over the years. Once we switched, and then the premium increases kept coming, and when they'd analyze it, the annual premium increases were usually 3 times the increases in the claims that were paid, and where is the money going?
What's the justification?
Well, they had justification. We have to rebuild the reserves, and we have to establish a higher reserves, and now we use a higher trend rating, and that's very nice, but I couldn't justify spending the museum's money and possibly losing those benefits because we might run over budget. It just didn't make any sense. All the seminars that we went to showed the trends going up. We were worried about 8% of GDP then. Now we're at 17, we figured the trends were that during our lifetimes, healthcare costs would exceed 100% of GDP, which can't be. So I took it away from the insurance companies, even though it wasn't. It was a mavericky thing to do because my colleagues in the other culturals were not doing that. Major corporations for decades had self-insured programs, but on a smaller scale, it just wasn't done. But at this time, I found that there was a reinsurance available, for catastrophic, so we could protect ourselves in case the claims ever exceeded 125% of what was projected, and they never did. Even with only a few hundred people, it's relatively predictable, what your expenses are going to be. Some people have more, some have less. It kind of works out. So the insurance companies do not provide any health care. Their innovation is to avoid making payments, to only insure people who they think will not cost them a lot.
Is this your insights now, or are these insights you had when you were in this position
to deal
with it?
The insights in that position was, I am not going to go along with the insurance company. I'm taking it away from them. And I told my superiors at that point that, the way the trends are going, within 3 or 4 years, we're going to have a national health program. Because this didn't make, so I'm still doing penance for that gross error of judgment.
What year was that, or what?
July 1991.
Oh, okay.
All right. So immediately our costs, we reversed 3 years of very high inflation, and it kind of advanced much slower, from then. And I'm enjoying those benefits now in retirement. And as a matter of fact, the third-party administrators for those plans, for the medical plan is now Aetna, and the third-party administrator for the dental plan is Cigna, and they cut checks or pay money out of the museum's account, and they're paid only for their professional services. They have wonderful, talented people. It's not their fault that they're screwing the whole public. This is something that's not illegal. Their fiduciary responsibility is to make a profit for their shareholders and satisfy Wall Street, and it's our mistake as a society to have given them that license and continue to do it. And we can't kick the can down the road anymore. It's become cemented in place and grown into a big boulder, and I don't think our politicians want to cast their future by trying to kick that boulder anymore.
Now, let me ask you this. You said you were a maverick for doing what you did.
Yes.
Did you have sympathetic colleagues in other industries or in other aspects of your line of work that were agreeing with you?
No, I found consultants and other people that I talked to get advice, but I found that I could buy the reinsurance, and I planned it out, and I told my superiors, this is what we're doing. Okay, so we went along with it. But the other culturals that we regularly met with were not doing that, and I don't know if they have at this point. But one thing I want to be clear that the employees of the museum were very appreciative of all the work that we did with other tax shelters, 403B, 401k plans, everything else that we put in, and we made sure that we followed up with them and kept them well informed. And if they were getting close to the deadline, they didn't meet, we got to them. Before I was leaving, when they hired a new benefits manager, first meeting with him was, okay, tell me about the lawsuits you have. I said, excuse me, we don't have any lawsuits from our employees. We're spending a lot of money on benefits. We want to make sure they understand what they're getting and make the right decision. So Years later, when I went back to have dinner with friends at the museum, we were walking through the Hayden Planetarium, which is the Rose Center now, and about 4 or 5 electricians come running up to ask questions to me about their pension plan. They just didn't trust the people who were there to give them the right answers. So, but they were comfortable talking with my staff in my office. Very few people running this, but it was run very well, and you know, they were comfortable sharing personal information.
So you thought in 1991 that it wasn't going to be too long till we had some kind of national plan that would eliminate the impact.
Yeah, Hillary came in with good intentions, but worked behind closed doors. It was
so when the Clinton administration began, and there was all that talk about we're going to resolve the healthcare dilemma in 6 months or whatever.
Yeah, well, it didn't work out that way, and what they were pushing for was nowhere near single payer either. President Obama, before the election, years past, was very eloquent, as he is on many things, but in support of single payer. And he was also coming to Washington to eliminate the influence of lobbyists. I think when he arrived, he probably realized that there isn't anybody else there. I mean, that it's overrun. You know, certainly in the healthcare industry, there's at least 6 highly paid lobbyists for every elected official, and you know, there's a revolving door. And they're coming back, they're influencing, they're making tons of money after they leave.
The members of Congress.
The members of Congress. And so, you know, we really need to remove that kind of influence, and I think the clean money campaign, which we've tried before, didn't work. We have just a compromised one coming up this year just for the position of Secretary of State to get a foot in the door.
Right.
But it's worked in Arizona, it's worked in other places, and hopefully we'll be able to do that. But if we are, you know, successful in getting to single payer, maybe if not in this congressional session, but very close to it, this will eliminate a major amount of money they're spending. The industry is spending over $100 million a day, $1 million a day to frighten people and to work with Congress to make sure that they continue to make profit. And the Baucus bill, which I'm glad is, you know, finally just about over because he wasted 3 months, but the Baucus bill would be the biggest welfare payment to the corporations.
And that whole process is just beginning. We're going to take a break now. When we come back, lots more to talk about.
Absolutely.
All right.
Yes.
Hello, I'm Senator Ellen Corbett. I'm proud to be a Democrat. I've been a Democrat all my life. The reason that I'm proud to be a Democrat is I believe the Democratic Party is the party that cares about the environment, who cares about the future for our children, who will fight to make sure we have the best education for our children, and who fights for civil rights, and is the party that is the party of inclusion. If you'd like to get more involved with the Democratic Party, please call us at 408-445-9500.
Welcome back to Democratic Television and our guest, Bob Applebaum. Bob, sounds like you feel pretty passionate about healthcare reform,
yes.
Maybe because you had so many years of experience working with insurance companies. Sounds like your goal would be never to have to deal with them again. What is a single-payer system? Why don't you let us hear a definition or an explanation of single payer?
Well, right now we have a multiple payer system. Actually, there are thousands of payers, all different insurance companies. There are thousands of insurance companies and tens of thousands of different policies. They're all different, and you know, they're collecting money and they're negotiating individually with hospitals and doctors. Single payer system means there's only one location that collects all the money, such as the federal government, as they do for Medicare, from your paycheck, and they make the payments directly to the doctors. It's the most efficient method. You have the largest pool because you have the whole country in that case, and so it's much more reasonable. And right now, estimate that, well, the overhead on Medicare is somewhere around 3%, and the overhead on the average insured plan is somewhere around 30%. That's a lot of money.
Well, that's a lot of money that's not going to health care.
That's a lot of money that's not going to health care, and a lot of people are dying and going bankrupt. But the estimate now is that if we went to a single payer, and that could happen very quickly, we would be saving $400 billion a year in administrative costs alone. and we'd be eliminating massive amounts of bureaucracy, both in the federal government and even larger amounts in all of those private health industries. So that's a lot of money wasted, a lot of money going for advertising, for outrageous salaries, for stock market, certainly for profits, and also to support our political system. Mm-hmm. So, there are other countries that have single payer, but there are other countries that have several, payers that have choice of programs. But in all of those cases, those are coming out of not-for-profit funds, and they're in many cases regulated like we do utilities. This is a uniquely American system to have for-profit health insurance, and it inherently incorporates a fiscally disastrous and deadly conflict of interest. The latest reports now from doctors at Harvard, MIT, there are 45,000 people a year who die who have no insurance, and there are many more who die for inadequate insurance. The statistics, the statistics for the World Health Program was that we rate overall 37th, just above Slovenia, but those are actually quite old statistics, and I think Slovenia may have improved by now. Oh. So, but the more recent statistics on personal bankruptcies, there are about 1 million personal bankruptcies a year in this country related to health care. 62% of all personal bankruptcies are related to health care, and of those, 78% had insurance when they first got sick. Duke University Medical Center has a hospital unit with 900 beds. They need 900 administrators to handle the claims. This is total insanity, and I am pushing for H.R. 676 for mental health reasons, because I think it's the most appropriate treatment for the insanity of our public health policy.
Okay, so you mentioned H.R. 676. So there's the concept of single payer, and then legislation that's been introduced, yes, to encapsulate single payer. And we also have the discussions going on with Senator Baucus and others. Tell us a little bit about the dynamic, and I realize that as people may watch this show, these things change every day. But just give us, there's the goal that you have, and frankly, others like the Democratic Party, and then there's the current discussions.
Well, hopefully we're part of the current discussions, although we've been pushed aside from the very beginning. From the beginning of this administration, the understanding was that, this is just not going to happen, and so they took it off the table from the beginning. But we've been pretty persistent in this movement across the country, and it's quite large. So we have Conyers bill, which was first introduced 2003,
and that's 676.
676, reintroduced every year, and active, very active now. Bernie Sanders has S703 in the Senate, which relies on states a little more and has more provisions. And there were 5 committees, 3 in the House and 2 in the Senate. Baucus is the last, the Finance Committee, to get his bill out. It should be voted on by the time this show is presented, and that is the most onerous of all of them. It provides the most profit protection for the insurance companies. The other Senate bill does have a public option in it. The H.R. 3200, the tri-committee bill from the House, has a much stronger public option, but in any case, that public option has been cut down so that it still will affect very few people will have the choice of getting the public option. Obama has stated that immediately, as soon as the legislation is signed, the insurance companies will no longer be able to drop you because you got sick or not cover you for pre-existing conditions. And there are certainly very beneficial changes and reforms that are in there. But the whole system with the exchange, including the public option, if there is one of any value, won't take place until 2013. And even when it does, we're not getting rid of all these massive bureaucracies and all this administrative costs. So any savings are going to be quite marginal compared to a single payer system. H.R. 676 has been endorsed, right now by 87 co-sponsors in addition to John Conyers, whose bill it is. It's been endorsed by the U.S. Conference of Mayors, which is about 1,100 members representing every city in the country, over 30,000 population. It's been endorsed by Philadelphia, Baltimore, Chicago, Seattle.
In Santa Clara County, the Board of Supervisors
Yes.
took a position. What was that?
Well, last week we were finally able to get the Board of Supervisors to endorse. One of the reasons I applied to become a member of the Health Advisory Commission was to get it.
Of the county.
Of the county, and we were not. But our supervisor, our former city council member and Vice President Dave Cortese, in June he came out with a study that he presented that showed that if 676 was made into law now, the county would save about $189 million a year just on the employee payments for the employees' health care and dental care. And even if the county decided that they were going to pay for the employee share, they'd still save about $140 million. That would, I think, would pretty much wipe out the deficit. So there's fiscal responsibility in doing it, aside from the moral and ethical considerations, because under the single payer, everybody would be covered from birth to death. It would cover wellness, preventive care, all your medical care, dental, prescription drugs, long-term care, no co-pays, no deductibles, no worry about bankruptcies. You can plan your life, pursue the career that you want without worrying about losing your health coverage. We're just strangling our country now with this, and all of it because we have a for-profit health insurance company, and we have Wall Street that wants to see them show bigger profits. So.
Well, they also seem to have a fairly effective public relations effort underway to try to malign single payer and compare it to whatever problems may exist elsewhere. And unfortunately, they seem to be very successful.
Well, they're not all that successful because the people in Britain and in Canada are very annoyed, and they're coming out with. In fact, Saskatchewan was the first province, and the man who put it in is a national hero, and the people are very happy with what they have, and they would never think of moving to a system like the United States has. And as I said, no other country relies on for-profit health insurance. But the Netherlands in 2006 decided, well, maybe we should see what kind of benefit we have from the competition. So they took a small part of their nonprofit pools and turned it over to for-profit insurance companies. And within a year, there were takeovers, costs were going up, and people were dropping coverage. So it just doesn't work. Taiwan in 1996, they were in very bad condition. They had well over 40% of their population without any insurance at all. And they researched the plans around the world, and they adopted a business model very much like our Medicare.
Oh,
and
which is a single-payer system.
Which is a single-payer system, and it's very responsive to their needs. They covered everybody within the year, and they're running a little over 6% GDP, and we're past 17% now. Generally, most countries that have universal coverage are running 8–9% of GDP. About twice what we're paying here, and we fare very, very badly.
You mentioned something interesting, a lot of things interesting, one being Saskatchewan, starting in a province or a state equivalent. So my understanding is that it's been legislation in the California legislature to have a single payer in California. Tell us about that. Can that work?
Well, of course it can work. It would not be quite as efficient as a full national one, but very close to that. And we are fortunate in California that we are ahead of much of the rest of the country in having actually passed a single payer bill in this state, SB 840, and our governor vetoed it twice. We passed it twice. We will, 2011, we'll have a new governor. We'll still pass it again in 2010, and just to aggravate him, I guess. But eventually we're going to get there. Now, there are amendments to the HR 3200. One of them that I feel fairly secure will remain in the bill, and I hope will remain in the final bill after conference, is a Kucinich amendment that would not require an ERISA waiver from any state that wanted to institute their own single payer. It would make it easier. There wouldn't be the threat of loss of funding. So since that passed in committee with strong bipartisan support because it's seen as a states' rights issue, so I'm hoping that that one will survive. And of course, there's the Kucinich amendment, the Anthony Weiner amendment, who was introducing it in committee to replace most of the 1,100 pages of H.R. 3200 with John Conyers' bill H.R. 676, which is 30 pages double-spaced, pure poetry. There's nothing hidden there. No excuse for not reading the bill or not understanding it. It's very clear, very straightforward, and hopefully, well, in committee he was going to take a vote on that, and Henry Waxman says, hold it, wait. I just got word from Pelosi that if we don't take a vote in committee, it will be presented on the floor of the House. It will be debated, and there'll be an up and down vote, and that was going to happen, they thought, mid-September, but it will happen now before the legislation is closed and before it goes to conference committee. And I'm hoping we're going to get strong support, and I hope everybody tells their congressmen and their...
Well, great. We have a few seconds left. Bob, is there some way that people can get hold of more information about this? Is there a website?
I'm working for healthcareforallcalifornia.org. Get a lot of information from Physicians for a National Health Program, PNHP.org, healthcare-now.org, onepayer.net. There are many websites that are available. There are many organizations all over the country that are involved now and very active in this movement, and it's amazing how much we've advanced in the last 2 years.
Bob, thank you for educating us about single payer and the need to reform our healthcare system.
Thank you.
Thanks for watching Democratic Television. Give us a call at 408-445-9500. We'll see you on the campaign trail.
Over and out.